Our goal has been and continues to be a focus on the highest level of care and safety to our seniors. I am pleased this afternoon to welcome the Honourable Stan Cho, Minister of Long-Term Care, for a special announcement. Thank you.
Well, good afternoon, everyone, and thank you very much, Maria, for that very kind introduction. It's really great to be here, and I want to thank the whole team at Belmont House for hosting us today for what is an important announcement and for the amazing work that you do every single day. Also happy to be joined today by our wonderful MPP from Eastern Ontario, the Parliamentary Assistant at the Ministry of Long-Term Care, John Jordan, who's doing incredible work in making sure that we treat our seniors with the respect and dignity that they deserve. Before I get into the announcement today, I do want to point out that I'm joined by several team members from the Ministry of Long-Term Care today, including our Director of Communications, David, who's it's his last day at the ministry. He's moving on to sort of the next chapter in his career. David is the one who's responsible for writing all sorts of great remarks and speeches and remarks like you read on the teleprompter. And I've never done the best job of reading those remarks exactly. And in honor of his last day, today will be no exception to that. So let's get into it. As we know, some of our great, wonderful people who live in the long-term care homes we service are in need of special care, and situations that many of us would take in stride, like a fall or simply feeling unwell, well, that can be extra challenging for them. And a trip to the emergency department can be particularly distressing. At minimum, a trip to the ER impacts a resident's quality of life. At worst, the trip alone can have lasting negative effects on that person's health. And I think we have all experienced that with a loved one when they go to the ER. So imagine what it would be like to residents if some emergency department visits and hospital stays could be avoided entirely. If instead of residents going to where the medical equipment is, the equipment would come to them. That's exactly what we're doing. It's my pleasure to be here today to launch a number of initiatives, 3, that will provide long-term care residents with faster and more convenient access to diagnostic services. These initiatives are part of our government's Your Health, a Plan for Connected and Convenient Care, and it's designed to reduce avoidable ER visits and hospital stays and improve residents' quality of life. Starting today, we are launching those initiatives that will address key gaps and barriers that prevent long-term care residents from accessing timely diagnostic services. So let's get into it. Number 1, we are bringing more diagnostic equipment, training, and clinical supports to long-term care homes. Number 2, we are improving access to lab and diagnostic imaging services for long-term care residents. And number 3, we are strengthening partnerships between long-term care homes and hospitals and the community. So let's get into a little bit more detail. Let's start with the Equipment and Training Fund. This fund will be open to all long-term care homes in the province and will allow them to apply for diagnostic equipment such as bladder scanners, ultrasound machines, IV pumps, and ECG machines, and training to support the management of key conditions. This means that more long-term care residents will have access to diagnostics and treatment in the comfort of their own home. It is important to thank Ontario Health, who has been a key partner and collaborator in this very important work. We're also launching a second initiative to boost access to community lab services. From now until the end of March 2024, we're increasing the reimbursement amounts we provide to long-term care homes to cover the cost of mobile services from community labs. The maximum reimbursement amount the government pays to homes to cover the cost of mobile lab services hasn't been updated in over 20 years. Not only will our increased funding address these outdated reimbursement amounts, it will help community labs to increase services to long-term care homes so they can meet better the routine and urgent needs of residents. Now, this is just the beginning. Later this year, we will be rolling out expanded access to specialized teams of nurse practitioners and registered nurses. This will be known as nurse-led outreach teams in areas of the province that are underserviced. These nurse-led outreach teams will not only increase nursing and primary healthcare support to long-term care homes, but they're going to be instrumental in helping to avoid those unnecessary transfers to the ER, preventing hospital admissions and reducing hospital length of stay. The job's not done. In the longer term, we will continue to work with our partners to launch initiatives to support more capacity building, more access, and more partnerships with long-term care. Improving access to more diagnostic services will allow residents to receive the right care in the right place. You know, we talk about the investments into capacity of long-term care all the time. We say $10 billion to create 58,000 new and redeveloped homes. That's not enough. We've had an aging population for a while. We have more immigrants to this country, many of whom are seniors. We need to also make sure that we're investing into the health human resources. And that's why our government has invested nearly $5 billion to establish a nation-leading standard of 4 hours of daily care per resident, to train 27,000 new PSWs, to keep the frontline workers within the healthcare sector with scale-up opportunities for their skills. But that's not enough either. You know, just before we made this announcement, I was having a great discussion with Lisa and Maria about outcomes for our wonderful seniors. And that's really what it is about for me. Doesn't matter where you came from in this world. My parents moved to this country from South Korea about 50 years ago, and through a lifetime of hard work, they gave me, my little sister, and my little brother a better life. That's the story of our seniors. Whether you came here 200 years ago, 50 years ago, or you're just coming here now, seniors are the ones who built this country, they're the ones who built our lives, and we owe them the dignity and respect that they deserve. Diagnostics are hugely important. It's about outcomes for our seniors. It's about better health care. Nobody wants our seniors to be waiting in an emergency room visit or long lines for care when they don't need to be. This is a step in that right direction. We know that the journey is not done. We're going to continue to work with incredible partners like Belmont House to make sure that we give the seniors the respect they deserve. I say it all the time. I'll say it one more time. They took care of us. We need to take care of them. Thank you so much, and I'd be happy to take your questions.
Adam, the Global News Minister, how do you feel that this is going to be able to improve the life and the health care of seniors and them being able to stay here in this environment and not having to go to a hospital emergency room?
Well, Adam, thank you for that question. That's exactly what this announcement is about. It's about the right care in the right place. And we know that technology has advanced significantly. It's allowed medical equipment to be more compact, to travel better, and to be administered or find results quicker. And many of our seniors with a simple ailment, whether that's just feeling unwell or perhaps it's a fall, they don't always need to go to the ER. And I think we all have experience with loved ones who go to the ER and then the waiting for hours to be administered. That's not just, pressure onto the hospital system itself. It's not at all a fun journey for our seniors. I think to my wife's grandfather who had to go through that journey and was in the hospital for days when really, if he had the diagnostics to be done in his home, he wouldn't have been at the hospital in the first place. This is a nearly $10 million investment as a first step to bringing those tools to the home, to the seniors where they need that care the most, and fully acknowledging that we will continue to invest in this sector, more investments into community care, more investments into home care, but this is just step one of that journey.
Minister, what would you have to say to people that would be proponents of this plan that would say that the provincial government wouldn't be doing enough to take care of people that are in their later years and need more attention, need more specialized care when they're in a long-term care home setting?
I'm really happy you bring up the issue of specialized care, Adam. Seniors are living longer. They're coming to homes with more complex needs. I just finished a tour of Northern Ontario, and I'm noticing that firsthand. That means that we can't provide what, status quo, expecting the outcomes to be different. That's why this investment into diagnostics, and I like to think of it as bespoke diagnostics for our seniors, is a step in that very right direction. This isn't the only stream where we're funding those those better outcomes for seniors. There's also a local priorities fund, which will look at specific targeted homes, areas, communities to say what specialized equipment, whether it be bariatric equipment or those with needs for dementia, are able to be serviced better throughout. We're renewing the local priorities fund and continuing to consult with the sector to make sure that we are providing the best possible health care for seniors. But today's announcement is absolutely a step in that right direction.
Okay, thank you.
Thank you.
Hi, Minister Chair Mike Crowley from CBC News.
Hi, Mike.
Hi. Wanted to ask you about the protective compliance inspections, proactive compliance inspections. There's a new report out that says that the ministry completed only 61 of these inspections on long-term care homes in the 2022 calendar year, which is basically 1/10 of the homes in the province. Why were so few of these proactive inspections done last year? Because the government, announced with quite a lot of fanfare the hiring of more inspectors and the plans to do these new style of inspections.
Right, Mike, I'm glad that you bring up inspections. The inspectorate was doubled, you're correct, with an investment of $72 million over the next 3 years. And to be clear to everyone, we have now in the province of Ontario, which has really never existed before, one inspector for essentially every 2 homes that we have in the province. Now, it's important to note there are 2 types of inspections. As you said, there are the proactive and the reactive. The reactive, of course, is in response to a situation we may have in a long-term care home, and the proactive are the ones where you go out in advance looking for certain standards to be maintained. And as we ramp up, we are making the whole process easier, simpler, faster, by making sure that reports themselves are not as cumbersome, worded differently. But it's an investment into the capacity, Mike, as well as an investment into the inspectorate. These inspections will continue to make sure that the homes are held to the highest standard that we can possibly do for our seniors.
What is your commitment, though, to pick up the pace of these proactive inspections? Because at this pace, it's going to take 10 years before every home in the province is actually a proactive inspection is completed at every home in the province.
Well, Mike, I'm going to make sure that we get out to as many homes personally as possible, but that includes going on some of those inspections to make sure that they are being conducted in the right way. It's not just the volume of inspections that are important, it's the quality of inspections, and it's also the results and how they're processed, presented, and presented to the public, but also internally at the ministry to make sure that we're able to act on the recommendations those inspections are bringing forward. We'll have more information to follow on the inspection side, but we understand we're going to the respiratory season, so we'll ramp up our efforts, and that update will follow after that. Oh, it's right on time. Thank you again. Appreciate it, everyone. Thank you so much.